There's a big difference between hospice and home health, but it's not always clear which one you need. In this video, we're going to sort out the difference between the two of them. My name is Mitch. I'm a physical therapist and a patient care coordinator with Premier Companion Care Services, and I'm here to answer your questions about home care and home health. Check out the other videos on our channel to help you make the best decision for your loved ones and family. Question number 1. What is home health? Home health is rehabilitative medicine that takes place in your home. When you discharge from a hospital or a nursing facility after an incident, an injury, a wound, any of the sort, you go home. And when you go home, you need to continue your rehabilitation. Now, that's where home health comes in. That can be a mix of nursing, physical therapy, occupational therapy, speech therapy, or a combination of multiple disciplines. The ultimate goal of home health is rehabilitative medicine and restorative medicine. So you're looking to recover from the injury or incident that sent you to the hospital or skilled nursing facility in the first place. Question number 2. What is hospice? Hospice is end-of-life care. It focuses on psychosocial and emotional support, bereavement counseling, spiritual counseling and spiritual support, as well as pain management and symptom management, all in an attempt to make your end-of-life experience as comfortable and as dignified as possible. So what are the differences between hospice and home health? To qualify for hospice, you have to have a terminal illness or a life expectancy of less than 6 months. It's not really clear as to when you go on hospice, meaning there isn't an exact event that triggers it. It's usually a multidisciplinary approach. So a team of doctors or your doctor and a nurse practitioner or family members, they're all going to look at your symptoms, your life expectancy, your quality of life at current time, and you're ultimately making a decision to stop any kind of curative treatments for that condition. At that point, you're going to be referred to hospice. Now, generally speaking, a person on hospice is expected to live 6 months or less. That is the usual qualifying diagnosis for hospice. Again, this can range in a multitude of diagnoses. It can be anything really, but overall the idea is that the life expectancy is very short, and so you're no longer seeking curative medicine, you're seeking comfort care. Now, what qualifies a person for home health? Well, home health is the opposite of hospice. You're looking for curative medicine and curative rehabilitation. A doctor has to sign off on an order for home health. There's an expectation that you are going to progress towards goals, meaning that you're going to get back to the level that you were before you needed home health. So if you're walking without a walker or cane before, then you're expected to go back to that if applicable. Home health is a heavy focus on a continuation of care in your home. You go from hospital to home. A really easy way of thinking about home health is a transient stage in your total care. Your first stage was the hospital, and in the hospital, the goal was to get you home. Now, you're at home, it's difficult to leave, so you can't go to the next stage, which would be outpatient treatment. Overall, there's a multifaceted approach of rehabilitation from the hospital to the nursing facility to home health to outpatient. So that is the essential difference between home health and hospice. Home health is a transient stage in the ultimate goal of rehabilitation towards your prior level of function or where you were before this whole thing happens. A common question we get is, can you transition from home health to hospice? The short answer is yes, but really it takes a lot of decision making to get there. So you have to be documenting and showing that home health isn't working and there's a drastic change in quality of life or rehabilitative outcome. There's going to be a multifaceted approach, and the referring physician as well as possible team of physicians, your home health company, they're all going to collaborate and decide, are you a candidate for hospice at this point? Remember, the ultimate goal in home health is rehabilitation and restoration of function. So in order to reverse that role and go from home health to hospice, you're talking about a lot of conversations and a lot of decision making between the patient, the family, and the providers. Now, I know a lot of this is very confusing, especially for people who aren't in the medical field, and even for people in the medical field, it's still confusing. I have a great playlist on my channel. Feel free to check it out. It's going to break down all the differences between home care, home health, and hospice and help you make the best choice for yourself and your loved ones. So finally, which option is best for you? Well, again, it really depends on diagnosis and what your expected outcomes are. If you're looking for rehabilitation or restoration of function, then you're going to pick home health. If there's a good prognosis and a good outcome and it seems like you're going to make a full or at least partial recovery, you're still going to go with home health. If there's a poor prognosis or a poor outcome, if it's in multiple healthcare providers' opinions that overall there's just a very shortened life expectancy at this point, you're probably going to pick hospice. So let's break down the final question of home health versus hospice. Hospice is only for patients who have been given 6 months to live or less by a team of doctors or have a terminal illness. If a patient doesn't fall into that category, then most likely they are going to choose home health and a rehabilitative or restorative function approach. Remember, hospice is meant to provide comfort and dignity at a patient's end of life stage. Home health's focus is rehabilitation and restoring a patient to their prior level of function.